Welcome to Fredericksburg Mission, a podcast talking all things mental health and wellness in the Burgh, brought to you by...
How do you shorten the time it takes to buy a car? Car buying just got easier. Pohanka365.com lets you complete as much or as little of the car buying process online. Pohanka365.com. Car buying simplified. Anytime, anywhere.
Welcome to Fredericksburg Mission Podcast. My name is Angela Rivers, and today I am here with Nathanial Arnatt, the owner of Simply Sweet Health. Welcome.
Thank you so much for having me today.
Yeah.
I'm so happy to be here.
I'm so glad to have you here. You are a Board Certified Nurse Practitioner.
Yes, in family medicine.
Yes, and we have not had a nurse on, or nurse practitioner on here at all since I've done this podcast, and I have been wanting one. So thank you for being our superstar today.
Great, thank you. And now's the time to ask all of the questions that you had saved up.
Exactly, right? I have a few.
Okay, good.
But when you're going through a pandemic, and you hear all about the trauma in the hospitals and the behind the scenes things that nurse practitioners go through or doctors go through, it's great to have someone come and give that perspective. And so I've had questions about, what it's like and all these things. So here we go.
Great, thank you.
But before we go through all of those questions, let's talk a little bit about Simply Sweet Health. It is a very interesting concept, we'll put it that way. Something very different. I always think of the way my grandmother and my grandfather had medicine practice to them, and this is very similar, and I love the approach. When I talked to you on the phone, you went to a school that my children go to, and I love one of the things at that school, they talk about people thinking outside the box. And so this, to me, very values that thinking. And so I'm going to let you share, about Simply Sweet Health and what it is.
Thank you so much. Yes. So if I had to sum up what Simply Sweet Health is, it's really exactly what you said. It's bringing back old-fashioned medicine to the modern era. So what we do is we bring back the doctor and patient relationship, or the nurse practitioner and patient relationship, and bring that personal care back to medicine that's really been lost. It's very common nowadays to not know who you are seeing in the healthcare world, especially with the pandemic. There have been very challenging times, and so my patients pretty much, they rest assured that when they call our office, they're going to get in contact with me. They're not going to get in contact with someone else, unless it's my wife, who is my right and left hand person. So they might get in contact with her as well. She runs the operations, of course. We always say that when we start medicine, we do it under a philanthropy. We say, we've taken an oath saying do no harm. I believe that also applies to do no financial harm. And that's one niche that I'm fulfilling, is to offer very high quality, personalized care at an affordable price.
Yeah, and let's talk about that for a minute. We were talking before this podcast that with Simply Sweet Health, there's a membership fee. Yes,
so our model is a membership-based model. We charge $40 for children and $80 for adults per month. And this fee is really an all-encompassing, comprehensive fee. Of course, there are discounts given for families. And all of our prices, I wanted to tell you, are transparent. When do you get that in medicine? So you could go on my website today and you know how much you're going to be charged at the end of the month. So there's not some of the issues that we have with budgeting. So, my patients aren't afraid to go and see me because they're not going to be nickel and dimed.
Yeah.
So my patients don't have that fear of, okay, Johnny's sick. Can we take him? Can we afford to take him to the doctor? That gets taken out of the equation with our healthcare services that we offer.
Yeah, and then you pay per month, correct? So it's not an every time. So say little Johnny is sick 10 times in a month, he can go 10 times for that one price.
Absolutely.
Yeah.
What we're able to do also is we're able to use telephone, text, and email as well. So if it's just something small, a question that maybe you would be told to come into the office for I can answer over the phone. So if you have a picture of a rash, send me a picture of the rash. I'll help you out. You know, a lot of things can be handled without certain things, such as think about the process of having a sick child. You've been there, I've been there. You know, taking time off work, going in, being told maybe, you know, we don't have any appointments today. I'm sorry, you have to go to urgent care. And one of the things that we tell people, our patients, is don't worry about that because it's taken care of.
Yeah, and then where is your scope of what you do and what you don't do?
That's a great question. I get that question a lot. My office operates much like you would see a traditional family practice operate. Since I'm a Board Certified Family Nurse Practitioner and I'm autonomously licensed, I can work independently, and I can diagnose, treat, and I can prescribe medications just like you would normally go to. The main difference is my care is personal. So I have, we provide care directly to our patients. And so when, for example, we talked about someone just calling and saying, you know, I have a quick question.
Yeah.
I'm not going to make them come into the office because I don't rely on that extra income to have someone come in. In a traditional family-based medicine practice, you have to bring the patients in to make the money, to make that happen. And so that's how the practice is run. My model doesn't do that.
So then you don't take any insurance?
No. So I recommend that everybody who is a patient has at least a catastrophic plan. And, you know, we're in a car dealership today, and I told you I love cars. So I wanted to use this an example based on cars here. So let's say you have insurance on your car that you drive every day. When you go and fill it up at the gas tank, or get new tires, or you need an oil change, you don't use insurance for that. So what we do, patients who, for example, we have a accident, okay, in the car, that's when we use insurance. We don't use it for those daily activities or daily routine maintenance items. And so that's the difference between Simply Sweet Health and offering direct primary care as opposed to being healthcare insurance.
And direct primary care, is that also like you can go to people's homes, or is it more they have to come to you?
Absolutely. So it's one of the things I have become very passionate about. I did not think I would like it as much as I did. I spent this weekend with a 200-pound dog of my patients who I wanted to get a picture with. I didn't do it. A very big dog, so very frightening dog. But it was nice seeing their home, learning more about the patients on that personal level that we just don't get when patients come into the office. So absolutely. And for the patients that don't necessarily want, house calls, then I have an office, and the office is located right now off of 5 Mile Fork.
And it also helps with anxiety too, especially, my grandmother, for instance, is sick and she's got anxiety. And so coming to her versus taking her somewhere is helpful.
Now, we've all heard of white coat hypertension or white coat
I
syndrome.
have that.
I have it too. And it's bad for me because every time I go into work, I get high blood pressure. But I've seen it. I've seen it firsthand, and absolutely, I can attest to that. That when patients come into the office, it's an environment that's very scary. I mean, as children, we grow up, the doctor's bad, and as adults, we say, well, I have high blood pressure, I need to get it treated, so I'm going to go in. But doing something as simple as going to someone's house, taking their blood pressure at home, it's you would be surprised the difference in their blood pressure, and just being able to sit down and not having a rushed appointment. So I can sit down, I can spend time with my patients. Most of my patients, they get an hour with me whenever they want to see me. Of course, if they need less time, then that's fine too. We don't have to say stay here for an hour, but it is one of those things that I give patients the choice, and that's what I'm all about. I tell people, if you ask any one of my patients I have now, a lot of most of them would tell you that the reason why they like me is because I listen, and that's something I have found very hard to find. Even me, when I'm looking for a healthcare provider to see. I find it hard to find someone that's actually going to listen to me. Part of my medical philosophy is to do something called shared decision making. I'm very, very passionate about this. And for those that might not understand what this is, shared decision making is the process of the provider and the patient making a decision together. I'm not here to be a dictator to tell you you will be on blood pressure medicine because your blood pressure's high, where you might just be nervous in the office. So I give people the benefit of the doubt, and we work together. And so that's where I think my strengths are as a healthcare provider.
And it began with a dream. I was reading your website and a little bit on your Facebook, and it said that this began with a dream.
Yes.
So how did this whole vision begin, though?
Yeah, so a great question. Growing up, my mom was very sick. I was in and out of the doctor's offices with her a lot. And one thing I got to see at that time is I got to see the good and the bad with medicine. And so it really made a lasting impression on me when I was seeing my mom go through these hard times and having, one doctor tell her, you'll never get better. And another one telling her, I will be here every step of the way. And those doctors, those good ones, made such an impression on me. It really molded me into who I am today, as far as being able to remember. I always remember this. I say, okay, that doctor who changed my mom's life, I'm going to be that same person. I'm going to change lives. And that's what I'm super passionate about. And that's why Simply Sweet Health exists.
Yeah. And, doing it in Fredericksburg, was there a reason for that?
Absolutely. So I'm local.
Yeah.
There
you go.
So I grew up in Spotsylvania County, spent most of my life there in two different parts of Spotsylvania County. And currently I live in Locust Grove. So I'm still, pretty much
ventured
local.
out a little bit.
Ventured out a little bit. And I consider this my home. So, coming to this location today, I said to myself, I need to go over to Fredericksburg Academy and say hi to people.
Oh, yeah.
Just because I just still have that passion for taking care of our patients in our local community.
But how do you not get so attached to the patients? Like, what if there's something catastrophic that happens? How does that not impact you?
Yeah.
It might.
So absolutely. I think if someone told you that it didn't impact you, they would be lying. And so one thing we do when we're trained in school, in nursing school, as a doctor, if you're a doctor, one thing we learn is to create a barrier. And I'm not afraid of that barrier to keep myself from getting hurt with caring for people. I think having that care and compassion, if I'm spending the last minutes with somebody who's taking their last breath, that's important. It's very important to have that. And so do I get attached? Yes. Can I still make medical decisions for my patients? Absolutely.
It's a good thing to say on a podcast.
Yes.
And then what about if something happens, I'm sure people are thinking this that are listening, how do you protect yourself and your business, like legally, if something were to happen?
Yes. So something I found that was interesting is that the state of Virginia does not require malpractice insurance, which was interesting, for any provider. Do I have malpractice insurance? Absolutely. Do I have business insurance? Absolutely. Not because I'm afraid, but because it's just part of a normal practice. Now, I think the personal attention that we give to our patients, so things don't get brushed under the table. Let's say, I'll give you an example of a patient I had recently. I had someone come in who was scared to tell me what was wrong with them. And I said, why are you scared? Well, what's going on here? And they said, well, because when I'm here, you can only take care of two things. And I said, you're at the wrong practice because I can take care of 10, 20. How much time do you need? Let's talk. And so I genuinely had a patient that was fearful of just telling me what was going on with them because they had been at a practice where they were limited to two things.
Really?
I don't think that's the right way to approach medicine and the right way to care for people. And so that's something that really stuck with me. I tell people, I'm always learning, and I learn lessons every day through God, through life, through patient experiences. One person that really stuck out in my life, in my childhood, I have an older brother who's 2 years older than me. He's now living in Alaska. So yes, I have not been out to visit him because of the pandemic. I'm afraid to take the plane.
Yeah.
So maybe someone can help me with that. But he, when we were growing up, he could go up to anybody and start a conversation, and I was shy. And so I looked up to my brother so much. I said to myself, I'm going to be like him. I'm going to be the person that goes up to people and says hi and ask them how their day's going. Because it was something that was very hard for me to come out of my shell, but something very easy once I saw my brother as the role model. Kind of like I saw those other doctors that my mom was dealing with as role models in my life. And so I took that all to heart, and I'm bringing it all to my business.
Yeah, and now you talk to people all the time.
That's right. That's right.
You probably have to ask them how their day is.
Absolutely. Ask them how their day is and what's your blood pressure today?
And what's really neat, so your business, so when did it launch here in the area? Because you just had a ribbon cutting.
Yes, our official date was of our grand opening was on Monday, March 7th. And so we have been seeing patients on a low-key basis, you know, just for patients who are calling and needing help. So we've been doing that, but we officially started, you know, the actual business, the practice of our Simply Sweet Health on Monday, and it was amazing. You know, I have to thank the Chamber of Commerce and Wendy, who you do know, for her instrumental help in starting the ribbon ceremony.
And how do you hope that the business continues in the next 5 years or 10 years even?
Great question. So right now I'm in a shared office space, which is great. We love the other tenants there, but I see myself in 5 years expanding. I would like to eventually own our own building, have a Simply Sweet building, and also when the time comes to bring on another practitioner. So of course I'm not trying to hire anybody today, but when the time comes, you know, send me your resume if you're interested. But doing that, and then maybe in 10 years, having the opportunity to have multiple locations in this area, in the Fredericksburg area. I definitely want to stay local. Like I said, it's part of my heart, part of my soul to be here in this region. So,
what about people who are not in the region but maybe want to do telehealth? Could you provide that?
Absolutely. So right now I can provide telehealth services to basically anybody in Virginia. You know, I'm board certified in Virginia. Okay. And so someone, if they lived an hour away or needed some care or wanted to be part of the membership, absolutely we can. Of course, it's going to make home visits a little bit more complicated. We'll have to plan those for those people. You know, they'll definitely need to have a guest room or something for the stay.
Takes it to a whole other level.
Yeah. So. You know, we talked about the pandemic and how that kind of changed the face of healthcare.
Yeah.
I was going to tell you that some of my patients actually became fearful during the pandemic of even coming in and seeing us. And it was something that I saw, you know, I had patients that I would see a year later, you know, in 2021 say, you haven't been here for a year, your blood pressure is terrible, your cholesterol's bad, and oh, I ran out of medicine. And these patients, I say, you can't run out of medicine. You should have called me. And so one thing we had to do is really pivot to a new direction to offer more telehealth services. And that's something I'm very proud to offer, is that once again, people can reach out to me. I welcome my patients to call me, even if it's something small, even if it's for a recipe. You know,
you never know.
You never know.
Is it certain times of day, those that you say, please don't call me after 5, or is it more of like a 24-hour, you might get a call at 3 o'clock in the morning?
Absolutely. One of the things we do with our membership is we continually add value to our members. And one of the values that we add is that I am really on call 24/7 for my patients. If not me, then someone else. And so we're there to answer questions. Like I said, my wife works for the business as well. She's becoming a medical assistant, and so she'll get that soon. So she'll be able to help out more on the medical side. So you know, a typical day, if you were to message us or call us, the number goes directly to her, and then if she needs me, then it comes directly to me.
And you serve all ages, is that correct?
Absolutely. So we do birth to end of life, and I love taking care of kids. I have 3 of my own. It's funny, I tell everybody if they're gonna see me outside of here, I will usually have 3 boys grabbing onto my legs, as you're trying to walk, in the store. So if you see 3 kids hanging off of somebody, that's usually me. So, so I love children. I love taking care of children. One of the limitations we do have, there's also pros and cons to everything. One of the limitations we have is our practice is small, so we don't offer immunizations directly to our patients, but we do have something worked out with the Department of Health, where we coordinate visits and we can get vaccines for patients. I feel like that's a very important thing.
It is, yeah. And what about other services do you have to contract anything else out, or is there other limitations that you might have?
That's a great question. I can take care of 80 to 90% of all healthcare needs through the direct primary care model. So if someone needs an EKG, I do an EKG, no extra cost to my patient. So the actual cost versus the perceived costs on a lot of these items is different, because if you were to get an EKG at your regular primary care office, they might bill you or your insurance $70 to $100. It costs me 30 cents to do an EKG. Wow. Because I own the equipment and we pay for the little stickers that go on, little leads. And so the actual cost for me to do that is not a lot. It's not something certainly I don't have to bill my patient $70 for.
Right.
So abscesses, lacerations. So I'm still waiting. I have my special bags ready to go. I'm still waiting for my first call. So for someone to say, I've cut myself, I need stitches. It's one thing. It's funny. I've had a lot of experience in emergency medicine and urgent care medicine, as well as doing primary care and internal medicine. So I tell people, I do a little bit of everything, but one of the things I love doing, I love stitches. I don't like when people need stitches, but it's something that we do, and our members, it's a reoccurring theme. I don't charge any extra for it. So if I have certain things, of course, now we're on national back order, like lidocaine. I do have enough, but sometimes, if we're not able to do a procedure, it's because of something like a national shortage of something. So same with COVID tests, for example. I can do COVID tests on my patients and get them results right then and there.
And how has it been for you to practice during a pandemic, with COVID tests and all that kind of, has it been scary? Have you had to do things that, my girlfriend's a nurse practitioner, and she said she used to have to strip in her garage and come in.
Been there.
Yeah.
The one thing that I saw was sort of the fear of the unknown. I don't know of any pandemic that has occurred that you've been able to track it on the internet. I don't know did you ever see that you could actually track as the virus moved from
Not
one
really.
location to another?
Try to block that part out.
Yes, it's good to do that. So it's something where I knew exactly when it came to Seattle because we could watch it on the internet, and so it's something. It's kind of changed the face of medicine, being able to track that. I have been through the Ebola scare. I was working at Mary Washington Hospital in the emergency room during that time. Those were fearful times as well because you're fearful that it's not necessarily me I worry about bringing something home to my family. And so that type of fear did exist. I think as the pandemic goes on and we become more comfortable with more people getting vaccinated, and the relative sickness of people, of course, is still high based on your medical conditions, and as we go on, it's getting better. I would say I'm hopeful that this will, there's this saying, this too shall pass. I tell people that all the time who are worried about this.
Yeah. And people were, like you said, scared to go to places, go to doctors, or, for fear of getting the disease, or fearful of going to the grocery store. My mom sprayed everything down when she would get it, when she would go to the grocery store and come back, and, I'd get an earful from her all the time about spraying everything. So, that's a very real feeling.
Yeah, I've given myself a Lysol shower. So, you go in, you have to see a patient, you come out and you spray yourself because it's fearful. But I think things are actually getting a lot better. And the way that we can help patients is hopefully spend the extra time that they need, especially if, I'll give you an example. If someone has been exposed to COVID and they're just worried or wondering what do I do? I can talk with my patients. So I don't have to bill them for an encounter because, the monthly membership fee allows me to really operate under a very kind of the type of medicine I thought I would practice when I was 10, when I was, seeing these other doctors. I said to myself, I just really want to be that way. And I can say for the first time in my career, I'm doing it. And so, it's so good. I go to bed and I sleep well because I know I've done a good job and I've taken care of patients the way that I've wanted to, the best way possible.
Yeah. And are there other direct primary care facilities in like the United States and Virginia? It
is a growing trend in healthcare. A lot of doctors and nurse practitioners are trying to step away from insurance-based medicine because of the limitations. Don't get me wrong, insurance is good. And like I told you, I want everybody to have insurance for the catastrophic things, but insurance is a tool. If we, if we use a hammer for a screwdriver, we're not using the tool correctly. And so with the membership-based model, we can actually lower companies. So if I do work with small business, and I can actually lower their insurance premiums that they spend on their employees, because through the membership-based model, people are not using that insurance as much, and they can opt for a high deductible plan.
Very interesting. Very, very interesting. So this has got to be super easy. Okay. This has got to be a really easy one. I ask this to all the guests, at UMFS, we pride our families, our staff, our kids, our community as being unwavering champions. Here we go. How do you think you are an unwavering champion?
Yeah, so I thought about this question a lot, and I think this can apply to the healthcare world. We've all heard of healthcare heroes. I think an unwavering champion and applied to a healthcare model would be a healthcare hero. One thing that I would consider myself as an unwavering champion is an unwavering champion of good healthcare that takes care of the patient. And so.
Well, I thought that was going to be pretty easy, being in healthcare and helping and healing.
Yes, absolutely.
We see a lot of champions in that for sure.
Yes.
Is there anything that I haven't covered that you would love to share with our listeners?
Absolutely. So, so I wanted to talk a little bit about the process of signing up.
Yes, that's good. Thank you.
Yeah. So, so one thing that if a patient's interested in signing up, they can visit our website at www.simplysweethealth.com. And my number's on there. And there are also several other ways you can sign up. You can sign up directly if you don't even want to meet me. If you watch the podcast and you say, this is a great guy, I'll sign up.
Yeah.
There's a join now button. You fill out a couple of forms, and then you're set up. And so what we normally do is we reach out to patients, typically the same day, to set up a meet and greet. Okay. And what we do is we tailor our medicine to our patients. So there's no cookie cutter in our practice. So I usually start the conversation by asking patients, what is it that you want from us? In a wholehearted way, just saying to them, we're here for you, but let us know how we can help, and we're going to be there for you, whether it's something small or something big.
Say somebody has to cancel their membership. Can they do that as well with no penalty?
Absolutely. So this is not a typical, some people refer to this type of direct primary care membership as a cell phone bill or something. When I'm fearful of a cell phone bill, we don't have it in my practice. Yeah. So you worry about the contract. I have to sign a 2-year contract. I'm going to be sued if I, get out of this early. That's not true in our case. We want our patients, of course, if they're unhappy with the service or something, to reach out to us and talk with us because, it might be something simple I can fix.
Right.
But for those members who have joined, they've tried it, or they might have run into a financial situation where they say, look, I just can't afford this anymore. Yeah. We do work with those patients, by the way, but if it's something, or they're moving out of state, then what we do is we do a prorated membership for the month. So if you leave if you want your last day to be on the 15th and we don't charge you the whole month, I'll prorate the amount. And, I want to, of course, always leave on good terms.
Yeah.
And so.
For sure. And then, I don't know if you want me to share this on the podcast, but you mentioned to me that you're turning a certain age,
That's right.
And people are commenting that, why are you starting it now? And
yes.
So what's the guarantee for 10 years from now, like for members,
Absolutely. So the expansion of the business is very important to me. I will tell you something we did not talk about that's very, very important to me is that in a typical primary care office, you will need to have about 3,000 to 4,000 patients in your panel. Imagine filling a room with 3,000 patients and knowing each and every one of their names.
You don't.
My practice, for me, for example, I'm limiting my panel to 500 patients right now. So I will not see more than 500 patients. And that gives the personal care. So I am available. There's not a wait to be seen. We can do same day appointments or next day appointments. I can come out to your house because I'm not trying to juggle 3,000 patients.
Yeah.
And so that personal relationship with our patients is super important to me and something that I strive to only improve over time.
Yeah. It makes all of a difference too.
Yeah.
In a business, in a person, in direct care, it makes all of a difference.
Some people have asked me before, okay, I have insurance, so I can't be a member, right? And I tell them, you can be a member. We take everybody regardless of their insurance. There's just certain times that it makes better sense to use a direct primary care model. I'll give you an example. So for someone who is insured, who might have the best insurance, so Cadillac insurance, talking about cars again, sorry, Cadillac insurance or Nissan insurance. Yeah. So what we do is those patients, they can see value in our membership. And the reason why is because I can provide access that's not available with their current insurance. So if you get sick and you call and told, we can't see you for 2 weeks, sorry.
Yeah.
And then you're stuck with an urgent care or an ER bill that didn't have to happen. Time off of work. And just the aggravation, time is precious. And so I can save those people time and increase their access. Maybe there's a patient who has okay insurance, maybe has a high deductible, or the best case scenario is if the patient has what's called an HSA. Are you familiar with that?
No.
It's called a health savings account. So it's an option that's available through a lot of employers as an option. Health savings account, over the past 2 years, they've actually been approved to use that money from a health savings account to pay for direct primary care membership. So it's a win-win for that, and that increases their access to care. And if you have that insurance where you're using it only for the catastrophic events, then that's good for the company, that's good for you, but also maybe you don't have to meet that $5,000 deductible because you never had to use it because you have our services. We also take patients without insurance, and that's tough because sometimes people need referrals. I'm currently networking with local providers. And in fact, if anybody's listening to this podcast and wants to join me, I am more than happy to create relationships with the local doctors and nurse practitioners in the community that might be specialists to offer our patients and any patients cash pay prices. I'll give you an example. I have a contract with a local laboratory company. If you were to go, let's say, to the emergency room to get a complete blood count, a CBC, a very basic lab, that can cost anywhere from $80 to $150 at the least, or more. So if you don't have insurance, you're going to be sent that bill. I can get that for $2. And so because I've negotiated, because I've worked to advocate for my patients.
Yeah.
And so that's something that I pass that on. I do not upcharge
Yeah.
for
Definitely.
those.
That's so helpful.
So-
And I mean, to be honest with you, from an outsider's perspective, who does have insurance, the pricing is very comparable to my out-of-pocket cost when I go to see a doctor.
Yes.
It's
Absolutely.
not the same for everyone, but
Yeah, so copays, that's one way. I call it the insurance game.
Mhm.
It's one way that we can sometimes look better on paper, but then have, something else like,
Mhm.
oh, your insurance rates are lower. That's great, but you're going to
Right.
have to pay $50 for a copay.
right.
And so it's something. It's I don't think it's right to do that, and it's something that we're fixing.
Mhm.
And I'm here for the community, so
Yeah.
I'm just so happy to be here today.
Yeah, definitely. And to reiterate, before
Yeah.
we close, let people know where to find you.
Absolutely. So www.simplysweethealth.com. We're also on Facebook. You can reach out to me. We are on Instagram, and we're coming to a Twitter near you. To tell people that.
Yeah.
And our telephone's on there if you want to reach out and just ask any questions. Even if you have a question about a membership, that's fine. We like answering questions. I tell my 7-year-old this. He loves asking me questions,
Mhm.
and I sit down with him. I say, ask me questions. I love it.
Aw.
So the same goes for my patients or anybody who's interested. I just, here to help.
Well, thank
So,
you. It's such
thank
a
you.
pleasure to have you on, and thank you for being
you.
my first nurse practitioner superstar. I
Great,
appreciate
thank
it, and thank you for all the great work you did during
Appreciate
the
it.
pandemic as well.
Thank you so much.
Yeah, of course. This is Angela Rivers with Fredericksburg Mission. Of course, to learn more about becoming a foster parent, please visit www.umfs.org/foster. We'll see you next time. Thank you for joining us. I'm Angela Rivers with Fredericksburg Mission. Tune in at Apple Podcasts, Spotify, or anywhere you listen to your podcast. Join us again next week for our next episode.
How do you shorten the time it takes to buy a car? Car buying just got easier. Pohanka365.com lets you complete as much or as little of the car buying process online. Pohanka365.com. Car buying simplified. Anytime, anywhere.